I think if you look at the list of studies in CAR therapies, it's very, very long. I think the one expectation for sort of commercial use is that the Juno product, the JCAR or Lysogel, we all anticipate probably will be approved as well. So we have now 3 agents, at least in the United States. But in terms of sort of the future, the future for CAR therapies is some of the issues I've mentioned, whether combination with agents that could prevent T-cell exhaustion, whether targeting multiple antigens. I mean, there was a session in this meeting, one of the bench to bedside sessions, where there was full 90 minutes dedicated to discussing armored CARs which have inducible receptors, or just better constructs in general. There are plans to do knockout CARs that will not have the PD-1 inhibitory receptors on the surface. So again, there's plenty of research going on. I think one important area of interest is first how to bridge patients to CAR. As you are aware, this therapy does take several steps from the autologous T-cell collection to the time when we reinfuse the patients with their T-cells. So another area that seems to be of great interest is using the universal CARs, which would be CARs collected from healthy donors and sort of be ready off shelf to use immediately for patients with these diseases. I mean, one other thing I can think of that we're involved in is moving CAR therapies earlier to the treatment algorithms. So there are at least 3 randomized trials currently going with using CAR therapies as a second-line agent. As we all know, in at least diffuse large B-cell lymphoma, the treatment, sort of the traditional use of salvage chemo and autologous stem cell transplant in a Rituxan era doesn't appear to be very effective for majority of patients. So these trials are now pretty much randomizing patients who we would traditionally use RICE or RDHAB for salvage followed by auto transplant. So they're being randomized to the CAR-19 therapy versus sort of the traditional approach is just salvage and auto transplant. And a couple of these trials have a crossover allowance, which I kind of like, that pretty much everybody will have their CAR T-cells collected, and patients will be randomized, and for the patients who will not have success with the traditional approach, they will be able to get their CARs. So again, a lot of activity, and I think that overall, the future is quite bright for this modality.